Hi, I'm April, and this is Rougie. He is 18 years young. This is Susie, his loving owner. He's very sweet. I'm going to show you how I do an evaluation on a horse, and then I like to teach you how to fix all this. Here's some issues that we're going to be addressing today. Where the first rib is, calcifications of side bone. Okay. In my evaluation of the horse, I usually start at the head. Sorry, here's Susie.
Hi.
And right here you can see his cheekbones don't match, the zygomas. Straighten his halter. If you come down to his nostrils, you'll see the same thing. If you come up to his eyes, you'll see they're not in balance. And when you feel up here under the forelock, it's totally flat. So the halter has come forward, grab the back of the occiput and parietal and shove them down and forward. These are his up-down chewing muscles. These should be flat. These are his sideways chewing muscles. They're starting to atrophy. So because of the cranial bone shifting, he can't chew this way, and he's chewing this way. And that's what creates your hooks and waves in the mouth that need the dental floating. So it's actually cheaper to fix the head than to have to keep floating the teeth every year. As I go back through the horse, this extra muscling, you might not be able to see it on the video, but it's thicker, and then it flattens out because it's going to be sore. Oop. I'm sorry, buddy, I know. He said, whoop. Okay. So that reaction lets me know atlas and axis are not where they should be. And these muscles are overdeveloping when he's trying to get on the bit for the rider. Come down to the neck. Gallbladder 35 is my first rib indicator point. I'm going to wiggle on this side. Yes.
Yeah.
Wiggle on this side. Yes. Okay. If you've seen all my other videos, you know the circumstances when first rib is out, which happens as a foal before they're 7 months old. Okay.
Does it stay out?
Until we fix it. Okay, so when both first ribs are out, he can't move either shoulder correctly. So when he's cantering, he's trying to pick up both front like this. The only area that we have to pick up from is your psoas muscle back here. Okay, it's the only thing he has to pick up the front end. If I touch here, he's going to go into spasm. And if I touch here, he's going to go into spasm. Okay. Later on, I can show you how to diagnose this, but right here is this hip, and back here is that hip. So his hips are out. So I call it my diagnostics for dummies. The flat of your hand comes back down the side until it stops, and it should be in this line up here. So this hip is further back than that hip. Touch here, that's soft. Touch here, that's sore. So this ischium is like this. So his right hip is back 4 inches and dropped like this. I'm going to go through my lameness checkpoints. Come down off the tricep in this V of bone. His foot's pretty good. Hi, buddy. Squeeze on the tendon. Squeeze firmly on the suspensory, soft tissue. Boy. Do my circle. Outside hawk, inside hawk, so a little reactive on this inside hawk. Come up down to this side, lameness checkpoint, and push in here. He's bending a little bit at the knee. If they bend in the knee, it's in the knee. If they turn the foot out, it's usually in tendon and suspensory. Okay. I'm going to pick up the foot. If I use my yes-no, this knee is actually acting a little bit arthritic. Okay. Squeeze on the tendon. And tight to the suspensory, and there's a flinch. Hi, buddy. Boy. Okay, so he has something going on in this knee and right here in this suspensory. Remember that they're going to use a diagonal, so right rear is going to throw to left front, and vice versa. Okay. Going to do the lameness checkpoints here, and there's also stifle reflex checkpoint. And right side's a little bit sluggish. So he has atlas axis out, first rib on both sides. If I squeeze here, withers are going to be out. They kind of come like this and go over. So when I squeeze here, it's going to say, ow, ooh, ow, okay? And I don't even have to push very hard. That's that red thermograph that's on my website, where it's red and it's red. If I scratch under here, he doesn't have a lift for the belly. Okay. So that's how you can go out and start checking out your own horse. Hi, so now I want to tell a story about what the foot tells me when I see a horse. We're looking at the hairlines. You will see that the hairlines don't match. They're not quite round, they're not quite the same shape. Under that is growing side bone and ring bone calcification after the age of 3, because all the horses have first rib out by 7 months old. As I come around to the side, and you look at the hairlines, you want to see 2 hairlines that match, that have the same slope to the ground. So the left one slopes a little bit steeper than the right one. This is not anything about the farrier didn't do his job. It's how the horse chooses to stand on the hoof. And these are his front hooves. Do they match? No. They don't match because the horse isn't loading each hoof exactly the same. He's not able to use and engage his right hind. He's going to use his left hind more. Okay. There's the hind feet. Now we're going to come up to the front feet. Okay. Everyone should be looking at their horse's feet from the rear, and you're going to see all the changes, where it's high, where it's low. Coming around again to the front, you can put your thumb right here in the middle and push. It should be soft all the way around. And it's getting hard right here under my finger. Okay. You'll also notice that that hoof is a little bigger there. That's growing the side bone calcification. And what that tells me is his pectorals are really tight on his left lead canter, and he's jamming and loading there first, creating a calcification. This is the reason for doing your wound balm sweats, the product by Dynamite that I recommend. So once we get the body in balance, then we can get the hooves in balance and help to break down side bone and ring bone calcifications.
Okay. Well, April just went over Rougie, and there was a couple things that I was sure about, well, knew about from the vet, and then there's a whole world of other things that I had no clue. And I'm really excited to have her fix his rib, which I guess is the beginning of all the problems, right? When he was very young, and his back, and all the way down to his current injury, which is now located in the suspensory ligament here on the left front. So, yay, the vet could not pinpoint exactly where on the leg that injury took place, so it's good to know where that is, so we can fix it. Thank you.
Yeah, and the interesting thing is the area that breaks down is not where it started. It's the area of the body that had to work too hard to compensate for another piece. And I would say that it's his right hind not able to move correctly that's throwing stress to his left front.
Okay.
So now we're going to go figure it out.
Thank you.
I was gonna finish my cigarette.
Cool, good boy.
You guys can talk all you want.
Oh, we're like trying to whisper.
No,
And I
it's-
forgot she's doing voiceover.
Oh, okay.
So this is for all the people that have already paid to take my classes, that want to see how I run it together in the session. And then, so I'm going to be explaining it in a voiceover.
Oh, okay.
Got it. Well, can you explain while you're doing it, or do you need all your energy focus?
It's kind of nice if I can listen to him.
Sure. It seems like he's getting a lot of release. What does that mean?
Him releasing stuff. Said, it's my happy spa day.
Been having a dozen years. did she buy it? Who did she buy it from? She bought it for you. She did want it.
Good boy.
Looks relaxed, sleepy.
So she's doing the Atlas and the Axis.
That feels good.
Yeah. He's not bobbing his head up.
What?
He's not bobbing his head up.
No. He's a really good patient, honestly. He's being helped.
Oh, there it is.
Aww.
Yeah.
So you said your horses were like ready to go after a couple treatments.
One.
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 Yeah, and then, well, I still had to do my follow-up and my homework. But, I mean, Chandra is back and moving normally. I mean,
What happened to her?
her right stifle, she just started, like, lifting it up, and it wouldn't fall. Like, she was just bringing her whole hip up. And, like, I don't know why, because she was fine the day before in the show, and who knows what happened in the stall, or,
Right.
you
that's
know.
the thing.
Those are always so frustrating.
She gets up from a roll or something, you know, and it kind of weakened it. But she was tight in her groin area, and just this.
Was she unrideable and unusable?
Well, I didn't want to use her. I mean,
Yeah.
she felt okay, but I didn't want to use her and stress it out more.
Yeah.
'Cause there's something wrong when you do see something that's off.
Does she have a stand-in?
Yeah. Yeah, it was kind of a nice break, though, not to be in the full show. I could see other scenes I don't normally see.
Oh yeah, I bet. Such a great show.
Oh, thanks.
Is this side tighter?
They're both pretty tight. His neck's actually 2 inches longer than he's presenting right now.
It should be.
Well, it is. It's just hiding deep in
Oh.
the shoulder. It's just hiding. Yeah, you are. You are so sweet. Kisses and everything.
Sorry.
Oh.
Do you do this neck part on both sides?
Uh-huh.
Okay.
First time.
Okay. First time you can do both sides. Okay.
Yeah. After that, I just see where it feels tight.
Okay.
Oh, it's so tight.
Is that the first rib right in there?
Underneath the shoulder, yeah.
Oh, yeah.
That's okay. Now down. Do you know where your natural horse sensor training is? Down. You're so helpful. Yeah. Oh, yeah. Right there. You got all day. Never on the tail. You got all day. Good. Oh, that's okay.
You just flow into everything.
Well, that's what my students are always like. They say, you work on a horse. And I always keep touching them. Even when I went up from BP and bladder sleeps, just like you on a massage table.
Uh huh.
And I try not to grab them by halter.
The head.
Yeah. And then when you stroke in here, that releases all those nerves.
Okay.
You can actually see where this frontal bone is jammed down. It's not just a normal Arab
Oh.
Oh.
Oh, he's such a good boy.
There's no sound on it.
Yeah.
One more? Yeah. Okay. Where there's
Yeah.
and elbow. And we're gonna need some carrot pieces, or the longer the treat, the better.
That's really interesting, that shoulder lift.
You wanna go ahead and pause it? Right there. Go. Okay. Hi, buddy. Go ahead and put them down.
Wrong side, the other side.
Nope, didn't get it. I'll do it again. Yum. Go ahead and pick it up. I know I have carrots there. Too much work. No carrot. There we go. There.
Is that an adjustment?
Uh-huh. Now we're going to do the other side. That's the hardest adjustment that I do.
And
Go ahead and pick it up.
And so that's just putting the rib back in place.
okay.
The first rib.
They got 18 on each side.
Don't Arabs have one less?
Nope, that's
Oh,
lumbar.
I heard that one.
Yeah, but I think that was a neck bone. Go ahead and put it
That was a neck bone.
Oh my gosh.
Good.
Okay, babes.
Yeah.
Boy. Boy.
Yeah. All right. Could you just hold his head right here for me?
Wow.
Ooh. What a boy. This is part of your yoga. This frees up your shoulders. They can't do this, they can't side pass.
Oh, sir. Wow. Wow.
Good job.
Oh, God. She
Do
called
this
it.
one. I just go back to neutral because he's older to give him a break.
Okay, yeah, sometimes I'll just completely put it back down, but I guess you can do that, yeah?
Yeah, it's just to kind of let it hang.
Mm-hmm.
There. Oh.
Oh, look at that.
Oh.
His chest looks wider already.
And I'm going to do all the ribs on this side. I go through it really fast.
Oh my gosh.
And then I stay on one side.
Okay.
And then I'll go to the other side.
So this is also, what do you call this one?
It's psoas.
Psoas release?
Yeah. So
Okay.
I'm doing this one under the tail.
Mm-hmm.
So it's coming up.
How much pressure are you doing? 3
Um,
pounds, 4 pounds?
As much as the horse can take, but I'm just trying to move the fascia underneath. I'm not trying to beat up muscles. So you'll see it's more of a push.
Mm-hmm.
To kind of say, wake up, get blood and oxygen in here. So this, see how it's getting softer?
Mhm.
Yeah.
That's just fascinating.
This is what I do it to call when he's tight and he's hind end.
Good.
So, if you want to stop, we can go to the other side.
Okay.
You know, there was, remember, it was in his back, and,
Too. I don't know if it makes
ooh, I heard that.
Just a little nice and loose.
Where
I know, buddy. You ready?
He's like, maybe.
Yeah.
Look at his back go up now.
Yeah.
Okay. Good boy.
Yeah.
I know.
See how his hind feet and his front feet are wider?
Oh my
Yeah.
gosh.
Wow, they
Wow.
are. He always stood so,
So close.
close.
Right, but that's
No
just
way.
tight muscles.
Wow.
This one. There we go. Magic.
Did you do the Ishiem on the other side?
You only do it on one side.
Oh, you do it only on one side?
Yeah, it's only the side that the first rib was out the first time.
Okay.
Look at how that.
You see compared to,
Yeah. Like
So
when I
as the
started.
back goes up, then the head goes long and low. I know, buddy. Good boy. I know. So this is what we use if the horse is colicking too.
oh yeah, and the butt tuck,
Yeah.
which
The
works.
butt tuck.
Yeah.
This is one of the yogas.
I can't believe he's almost volunteering to lift the stomach.
Because he can now.
Because he can.
He couldn't before.
So when the ribs are out, ribs are like a little candy cane. They hook in a little groove, and you don't have to know anything else about them except you just lift them all. And then I'm using his round ribs to stretch his tight back. All these flat
What
spots
do you need them to do?
are muscles in spasm that want to pull the ribs back out. And that's what drops your top line and has you looking like an old horse, chasing saddle fit issues,
Oh,
specialty pads. My next client, she
specialty
goes,
pads.
$3,000 in saddles and pads, and it was only $95 to fix his body.
So annoying.
No,
Extremely.
all been there.
Yeah, and then he's getting collar withers. Yeah. So now
You'll like how he feels.
the
when you
shoulder
guys
is
run.
there and the wither is there. They should never be that close together. It should be shoulder, withers. So now I'm going to ask for withers to come up.
Wow.
Amazing, amazing.
Gained an inch.
I know. Now he's
Wow.
15.3.
Look at that.
Yeah, Chandra got taller too.
People say, stop it, my horse.
I do kick.
So right in here, it goes loop, loop. You can't come in the middle of the video. I'm just letting you know. It goes doop, 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 doop.
They're not.
Doop, doop, doop. So right there is like a little bit of kissing spine. So I'm going to do a tail pull. See how nice and square he wants to stand with his
I
spine?
can't believe
Yeah.
it. I'm shocked. I've never seen him stand like that.
That's how he should be standing, and then you grow good feet.
Yeah.
He says, oh, I like that.
He does like that.
I forgot to pull them back. Hello.
So you want to film that it's straight angle from the croup?
Hello.
Towards you, or
Well,
towards?
just the whole slope coming from the croup has to match. And then how
Oh,
how wide
yeah,
apart,
yeah,
how
yeah.
wide apart his hind legs are
Yeah, I got. I'll go back down from here
and
to
square.
there. Yeah, you hold for a long time.
Well, you want to do a minimum of 2 minutes.
Yeah.
And then I'm going to let go very slowly. Okay, he might want to walk off a little bit, just hold his head.
I know.
Oh, is that?
So this is the butt tuck.
Wow. I can see it from here.
Counting to 10, 7, 8, 9, 10. Ask for a little more. So if he
Oh.
drops down, I'm going to push harder with my right hand so he squares. I know, buddy.
Oh, wow.
There we go.
I know, right?
Hold his head. Just nicely. I know, buddy. It's a little bit tight for you. Good boy.
Good boy.
Yeah. Oh, good
And what does that
boy.
do? Just engage his.
Well, it stretches out all the tight muscles from underneath that you'd be massaging for hours. That is giving him the sway back. You're using his body. Hi, I'm April with Holistic Horseworks, and I'm going to show you how to evaluate your own horse and where your issues are coming from. If you get on a bucket safely behind the horse about 8 or 10 feet and you look at the back of your horse, look at your hips and notice is one hip higher than the other hip. This one's a little lower, this one's a little higher. As you look higher and you look at their back, you will see one side dips down a little bit more than the other side. And then you look at the alignment of the withers, the back, and the hind end. And this is why the straight treed saddles are working against the horse, because you're putting them on a horse that is not symmetrical. So you need to do your body work, and everything starts with first rib and the front end. Okay. I'm April Battles, Holistic Horseworks. This is another diagnostic of what's going on with your horse. You want to be looking at the hind feet. You do not want to see any cracks coming up through the frogs, but you're also looking at the balance. The hoof goes out here, it doesn't come here. The hoof is underneath here, it shoots out there. So when the body's not loading the hoof correctly, you get side bone calcifications in here and you get an underslung heel. As soon as we do the body work, we start doing the balm sweats so all of this can start to grow down from here. So there's your hind feet. If you look at your front feet, you'll see again 2 feet that don't match. Okay, this and this don't match. They're not symmetrical. Your farrier can only cut what's at the bottom. Okay, you need to be able to grow a hoof down correctly from up here down. They're very straight and underslung on the front. It tells me that they're pulling at the front end. They're not able to engage the hind end. That will tighten your pectoral muscles down to your abdominal obliques. In the hind legs, when they're straight on the inside, it tells me they have tight groin muscles, and that's what pulls your hocks in close together. So he has more hoof out here and less hoof under here. Tells me his groin is a little bit tighter than it should be.
Yep.
He is. I'm April Battles, Holistic Horseworks, and I'm going to be sharing with you the story that the feet tell me. Okay, so the hoof is going to grow down how the body is using the hoof. Your farrier and trimmer can cut it and trim it, but every 6 weeks it's going to grow back to how the body loads the hoof. Good boy. So he has more out here and more out here, and it's more narrow here. Tells me in the past he's been pulling with the front end because he was unable to engage the hind end. And the more they pull with the front end when they're cantering, the tighter the pectoral muscles get. That brings the front legs together. And then they're jamming and loading the hoof from the inside to the outside, and then part of this hoof will shoot out in this direction. These are all side bone calcifications that you can take down with the balm sweat. He also does not have a lot of heel. Okay. His heel should be coming down to here. Okay, and that's not the farrier's fault. Under here, there's hard deposits of side bone. This crack should not be going up this high. It should stop here. And once you do the balm sweats, this should start to grow down so he can actually support himself. In the hind feet, same thing. It's very straight here. The hoof is flaring out here. This is underslung, so that comes up to tight groin muscles, pulling the hocks too close together when he's trying to engage and use the hind end. And that's what all the body work's going to do, change how the horse stands on the hoof. And then the owner's homework is to do the dynamite balm sweats so we can change the shape of the hoof and help the energy meridians be more in balance.
Hi everybody, this is George. He is a horse that I've been riding for probably the last 2 to 3 years. And recently in the last year, he's been roaring while we ride, and it's usually when we're doing canter work. Tenses everything up, starts struggling to grasp air, it feels like. So we're just trying to address the issue today with April.
Hi, I'm April Battles with Holistic Horseworks. Let's see, where to start. So as you know, I always tell you to talk to your veterinarian. I don't replace your veterinarian. I just have some insights to what is actually going on in the body. I got these pictures from a veterinarian of what a roaring horse is, what it's affecting, your recurrent laryngeal nerve. Happy to email you this document. And all the tie-back surgeries, when I've asked the veterinarians, have always been on the left side of the horse because the laryngeal nerve runs in a different pattern on the right side of the horse. On the left side of the horse, it can be impinged by cranial bones dropped and compressed on this side, compressing this end of the laryngeal nerve, and by the first rib being out around this area of the heart where the laryngeal comes down and around the vagus nerve and all wraps in there. So every horse that I've worked on that had those symptoms had the cranial bones compressed on the left side and the first rib out on the left side. And once we release all those issues, the body seems to get a little bit better. We've gotten stage 4 roar to get back to like a stage 2 roar where they didn't have to have the tie-back surgery. So what I've seen on him when I look at his head, your occiput and parietal are dropped on this side, dropping everything on this side of his head. But he also has these swollen glands right in here that's also really hard and tight. compressing the area that the laryngeal nerve will be going through. We're going to be working on that. And he also had first rib out on this side. You can tell by this really heavy muscling that he had first rib out for a long time. So for the horses that roar that I've worked on, these issues have been in the body for at least 4 to 5 years before you start seeing the breathing issues. And my theory is that the nerve is compressed, and after a while it just can't do its job. So you have my equine cranial DVD for working on cranial issues, and my other DVDs for working on body issues. But start paying attention to, are the cranial bones compressed on the left side, and is the first rib out compressed on the left side? After we unwind all these issues, we usually do a cold laser therapy system in this area for 2 to 3 treatments in 1 week. And the same thing down here, helps break up scar tissue. And then we usually feed herbs, maybe silver lining herbs, for nerve regeneration.
All right, you're
this
on.
This is April Battles, Holistic Horseworks, and I like to show you how to evaluate your own horse's mouth. You don't need to pull the tongue and yank it to the side. I just put my fingers in the lips and I give them a big smile. And within a couple minutes, they just start showing you all their teeth. Doesn't have to be hard, don't have to pull, don't have to fight. I'll blow in their mouth or nostrils. You can see all the teeth all the way back that way. If you have any hooks or points in the front, you're going to have a matching one on the other side. Like if it's on the top up here, you're going to have a matching one on that same side in the back on the bottom. We're going to do some cranial work on him today. You can see his front teeth are crooked and need to be balanced. Equine dentist should be addressing that. There's his front teeth. The owner said that he's a horse that roars, so we're going to be doing some cranial on him today. The other thing we're going to be working on is getting these glands to drain. He has this on both sides of his neck. Okay. This is not muscle. Okay. This is going to compress your laryngeal nerve and your windpipe when he's trying to get air. And the side that is the worst is the side where the laryngeal nerve runs up here and up through here. And this is swollen all the way through here. Okay, so we're going to be working on that today. If you look at his head, you'll see that his eyes are a little bit out of balance. His cheekbones are a little bit out of balance. His nostrils are just a little bit out of balance. He's very sweet, cute. Okay. And when I feel up here, the occiput, your halter slides forward and catches on this bone up here. So you should be feeling under your forelock. It should be very high, like 2 goat horns trying to grow out of the hide. And this side is lower. So when a horse pulls back, the halter slides forward as they're struggling, and most horses end up sitting down on one side, and that's when all the cranial bones will drop on that side. So we're going to be addressing compressed cranial bones on this side and releasing first rib on this side and getting these, it's like our lymphatics up in here where they store toxins. We'll be doing the NCD detox on him to help drain this and some of my level 2 cranial work. Thank you.
Okay.
Hi, I'm April Battles, Holistic Horseworks, and for all my students out there, I'm going to film how I put a session together and how everything flows. I'm going to be doing a cranial session on him at the end, so I'm putting a lot of release on his head at the beginning. especially on this side, it'll foam and get hot where it's really needed. Release is edible. It's like rescue remedy. And I'm going to put more release on any areas that foam or feel hot. You do not want to see these muscles up here. These are his up-down chew muscles, and you can see that he's chewing up and down more on this side of his head. As these get bigger, your masseter muscle is going to start to atrophy right there. He's so fun. He's so fun. The hind end is always a compensation of the front end not able to move correctly, so I'm going to put release everywhere and pay attention to where any muscles are tighter, like right here. There we go. This is your governing meridian, conception. I'm also going to pay attention to how tight the pectoral muscles are. Come back up and do K27s. This side's really, really sluggish. You want to work it until it goes up and down, until it goes into a deep hollow. It means left side kidney's really sluggish. Oops. You can see it's foaming. So what this tells me is kidneys and glands, as he's had a lot of toxins. So this side goes really deep right away, and this side is still sluggish. Some more on the pectorals. He's really tight up in here. Again, that's what's causing the inside of his hoof to be straight down right there. So I'm going to put more release there. The tail points. Release on my hand, look for tight hind end muscles. This hind leg on the inside is way tighter than the other one. Yin yang, 1, 2, 3, 4, 1. North 4, south 1. Emotions. Release the trapped emotion, that is B32. You can release the trapped emotion, that is B32. B32 trapped emotion is now being released. You are now free and clear. The trapped emotion, that is B32. I use my fingers, column A, column B, 1, 2, 3, 1, 2. Next one, A45. Now release the trapped emotion. That is A45. The universe knows what it is. I don't have to look it up in my chart. A45, trapped emotion. Now release the trapped emotion. A45. I ask if I got it. Yes. Does it need any more? No. So I go into defense posture. And breathe. Rest your arms. This is the second session for this horse, so everything's going to go a little bit faster than if it was a first time session. Energy feels really stuck in this area. There you go. Yeah. That's the release, working on his head. Finish at the withers, do my 3 bladder sweeps this side. Yes. Oh, what a handsome boy. Yes. All his muscles are really tight everywhere, which tells me there's a lot of lactic acid buildup in his body. He needs the NCD detox, 4 bottles. That'll help clear out all these glands in here as well. Good boy. Yeah. Oh. Same thing this side. Personally, I like to keep a connection with the horse like a massage person would, so I kept my hand on his butt as I was coming to the other side. They don't like it when you stop, leave, come back. Just so that noise was more in sinuses and head. Hey, what you doing? Again, the energy feels really stuck in withers. Oh, it's a good boy. Yes. You can see where the color changes, and it goes from light to dark. Again, I like to keep my connection with the horse. So everything back here just feels really, really tight. Here's his hide, it moves. Nothing's moving back here. The fascia and the hide are just stuck together. When you have things that hard, you have too much lactic acid buildup. So if your liver and kidneys are stressed, then when you work the horse, they can't get rid of the lactic acid and the muscles stay tight. Atlas and axis. Hi. I just look for any area that's not soft. North finger energy is very light.
Sticky guy.
Go. Shorten the muscle, cross fiber friction. Brings in the blood flow. Stay on one side. Push, push, firm. Just shorten a little. And have his head as close to my shoulder to support my body. And over. There you go. If they're moving at all, it's not going to work. Oh, yeah. Oh, good boy. I know. I know. One more on this side. At this angle, you can actually see how his eyes are off center. Okay, so you can't get mad at the horse. I'm just going to hum or blow to distract him. Oop, there we go. Huh. You see his eye softening? Yeah. If you're afraid a horse is going to bite you, you can bit him up or put a cavassaw on. Shh. Oh. Shh. There you go. Oh. There you go. Push, soft, soft, firm. North finger, very light. Distract horse. If you get mad or frustrated, you're never going to get it.